Network Health Plan was based on a community insurance company created by physicians to meet the needs of local customers and local communities. The advantage of a provider-owned integrated healthcare system is that the decisions are being made on a local level. And by having Network in the communities it serves, it's helped work on those kinds of issues that positively impact the regions in which it's operating.
The main differences between Network Health and other carriers would be the flexibility, the innovation, and the willingness to want to understand the client and the consultant. So at the end of the day, it's a win-win for the employees who are navigating the medical system with ease.
We understand that there are underwriting cycles that groups go through where they have periods of good experience, periods of not so good experience. We're looking to partner for those long-term relationships so that really the goal is to deliver long-term, predictable renewal increases.
The advantages to having a dedicated account manager on each group that I work with means they get to understand the client inside and out. So when we place a group, that account manager is fully aware of what the client's looking for and what the end result is, so they can help us achieve the end, not worry about what's just facing us today.
When I tell them what I'm looking for, they usually come back right away with exactly what I'm looking for. There's not a lot of back and forth.
There's immediacy in responses, trying to get what's important not only for us as the brokerage community, but also to meet the questions and needs of the customer in an ever-changing healthcare delivery system.
Great example that I would give you, I recently implemented a large group. There were some big concerns in a large group, particularly at the executive level, about adult children on the plan that did not live in the area. Network Health's customer service called each of those members directly, walked them through exactly how services could be rendered and received and how they could outreach if they needed help. That's not customer service you get everywhere.
When you call somebody here, they know how to pronounce Appleton and Waukesha, and they know where these places are. They have their friends and family living in the community. They're part of the community, and it's really a differentiator for us. When you call in, you're getting a person. You're not getting a phone tree or being transferred overseas.
They know exactly where we're trying to lead the employer, what the employer is trying to bring to their employees, and how the flexibility of the plan design makes a big difference.
I would recommend Network Health Plan if you are looking for a healthcare provider that actually cares and understands your business. They're willing to work with you and help you control the healthcare costs that are ever increasing.
When we compare Network to many of the other carriers that we would represent, we would rate them in the very highest tier of customer satisfaction.